Well, good morning. If you're in the right place, then you're going to hear a talk on cancer-related cognitive dysfunction, and with focus on strategies for improvement. My name is Myron Goldberg, and I'm a neuropsychologist at the University of Washington Medical Center. I also direct the neuro-rehab program. So cancer-related cognitive dysfunction has been a keen interest of mine over many years. So it's enjoyable to talk to you about it today, and I hope you have a great deal of questions that we can discuss if we have given the time. And as everyone knows, this is being recorded, and as previously talked about in the last presentation, we acknowledge the land of the Duwamish tribe and give our respects to the land that we are living on right now. And in transplantation, in bone marrow transplantation, regardless of it's allogenic or autologous, the key idea here, right, is treatment outcome. And I was talked about before, the treatment outcome with bone marrow transplant has become quite good. And the treatment, the outcome, it gets focused on survival time, time to regression of the disease, and remission and cure. And that's been one of the primary reasons for the bone marrow transplant for treatment outcome. But it always has to be weighed, right, in terms of what potential side effects there may be, and the treatment toxicities that was talked about before, and how well things have gone in the past several years in reducing those toxicities. Oftentimes what the treatment focus on is, in terms of side effects, has been on physiological side effects, right? Nausea, appetite loss, fatigue, vomiting, and so forth. In more recent years, though, the treatment side effects, the focus has been, aside from the physiological side effects, has been on quality of life and satisfaction. And what we're going to be talking about is about quality of life, also on neurocognitive functioning, cancer-related cognitive impairment as a potential side effect of the bone marrow transplant procedure. And when we talk about cognitive functions, just so everyone's on the same page, we're talking about things that we really take for granted in ourselves. We don't reflect too much upon how good our attention or concentration is, or processing speed, learning and memory, word finding, executive functions. And by the word executive means our higher level abilities like problem solving, thinking flexibility. But those are the things that we want to think about in terms of potential side effects. And what we're going to focus in on today is the extent of cognitive difficulties that recipients of bone marrow transplants experience, the types of cognitive difficulties they experience, potential risk factors for those difficulties, and importantly, strategies for improvement. Frequency of cognitive symptoms. It varies across studies. If you look at the literature on cognitive dysfunction, cancer-related cognitive dysfunction, including in bone marrow transplantation, it can, if you ask individuals, have they seen a decline, have, a self-reported decline, 50 to 90% across studies, and quite high. The 50% were in the 90%, quite high, that people see a change in their cognitive functioning. If we do measurement of cognitive functioning, that is, actually test, cognitive abilities like attention or memory functioning, that percentage goes down in terms of cognitive dysfunction that we would call impairments and such, and about 50% is often associated with treatment. So there's the discrepancy, right, between what self-report is and what we might find on testing. I'm a neuropsychologist, so I do a fair amount of testing of cognitive functioning, but I pay particularly attention to what the patient is saying, what the individual is saying about their experience of their cognitive functioning, because it could be different reference points. For the individual, they're comparing themselves against what their baseline is versus what it is now. In testing, oftentimes, particularly in research, there's a set criteria about what impairment may be, and that an individual may have a decline, but they may not go into the impaired range. And so therefore, they're not classified as having, quote unquote, cognitive difficulties necessarily. So the reference point may be different. For an individual, is they see a decline. In testing, there may be an absolute value that we're looking for in terms of, did the person go below the point where we might say it's impaired functioning and such. So the types of cognitive problems that oftentimes arise after bone marrow transplant procedure are in these areas: in learning and memory, attention, processing speed, executive functions, as we've talked about before, kind of that higher level ability in thinking flexibly, doing problem solving, and verbal fluency, having that ability to find words to express yourself. But one of the common things that I get to hear about is individuals having difficulties in expressing themselves, finding those words. We all have that difficulty, tip of the tongue phenomenon that can occur, but oftentimes after treatment, that tip of the tongue phenomenon gets more frequent and such. Sometimes the degree of difficulties is labeled as mild. Even the individual may say it's a mild difficulty, but it may not tell the whole story by just saying it's mild. Any of us here would not want to see even a mild decline in our cognitive abilities, but oftentimes even mild abilities, when it gets matched up with our demands in a demanding environment like a work setting, that can make a huge difference. Even though the difficulty may be mild in degree, it can have some effect upon, a great effect upon our functional status. What's the duration and course of cognitive difficulties if we look across studies? Well, as you might suspect, what I might say about that is that it varies a great deal. And that's really a truism when we look at research in terms of the duration and course of cognitive difficulties for individuals following a bone marrow transplant. Many individuals, even before they have the bone marrow transplant, and the range may be 30 to 50%, may have some cognitive difficulties when we do measurement of their cognitive abilities, even before the bone marrow transplant has been initiated and such. And that could become because they've had prior treatments and things, or hosts of other factors that we'll talk about that can come into play that affect cognitive functioning. So they may be at a one down position in terms of cognitive functions even before they start the bone marrow transplant procedure. Following the bone marrow transplant procedure, about 1 month, if we do look at studies that look at testing, about 50% of recipients experience decline, after bone marrow transplant procedure. So we do testing before, the procedure, and then testing at 1 month post procedure. About 50% will see a decline on testing. And then the course of cognitive symptoms varies across studies, with some individuals showing improvement by 12 months, 18 months following the transplant procedure. But there are studies, and there's one in particular that I cite, that 30 to 35% of people with allogenic transplants and 19% of autologous transplant procedures showed evidence of persistent impairments across several years. And so there's some persistence and difficulties that we have, that a person has. So it varies across individuals. That I was talked about before in the prior presentation. A lot of factors come into play in terms of the onset of cognitive difficulties as well as the course of cognitive difficulties. Some treatment-related factors related to cognitive dysfunction: prior cancer treatments, chemotherapy, radiation therapy, transplant type. If it's allogenic, for example, the donor relationship can come into play with respect to increasing the risk for cognitive dysfunction. Type and intensity of chemotherapy or radiation therapy during the transplantation process can affect cognitive functioning. Whether or not the individual had some type of delirium right after the transplant procedure can start to predict, if they're going to have cognitive problems, 1 month or farther down the course of recovery. And then, of course, transplant complications, as was talked about before, in terms of graft versus host and possible infections coming into play, being all risk factors for the development of cognitive dysfunction following transplantation. Some mechanisms that's been speculated in terms of what causes the cognitive dysfunction. A lot of it centers around how chemotherapy toxicities or radiation toxicities are affecting the brain. There can be metabolic changes causing inflammatory reactions, depression of nerve cell generation and repair. Our nerve cells are repairing themselves, and then sometimes the treatments or chemotherapy, radiation therapy can affect that repair. And then another topic that comes up in the discussion regarding particular potential mechanisms is another inflammatory reaction that I won't go into too much, but it's called oxidative stress. Medications for graft versus host disease after stem cell transplant can have some neurotoxicities that can affect brain functioning and cognitive functioning as a result. And then chemotherapy affects upon other body organs that, like the liver, the kidney, that if they are being affected, they can affect brain functioning and therefore lead to some difficulties in cognitive functioning as well. So is it all, when a person is experiencing cognitive dysfunctioning following a bone marrow transplant, is it all from the procedure? Probably a little bit of that, and maybe some other factors that come into play. And it's typically is what the word we have is multifactorial. And this is an important idea, I think, in terms of not just trying to understand cognitive dysfunction. If you're having difficulties following a blood transplantation, but also the treatment of it as well. And using a model that we call the biopsychosocial model becomes important. And if you take anything away from the discussion of the day, kind of having a mental set about, there's a lot of different factors that can fit into this biopsychosocial model that may be affecting my cognitive functioning abilities. And if we just, I like graphs and graph it out in terms of biological factors, maybe it's the chemotherapy, the cancer itself, psychological factors like stress, depression, social factors, demands on your cognitive functioning may all be playing a role in how you notice cognitive problems in your daily life. And if you look at the literature, we can have almost like a wheel with spokes coming out from the hub of the wheel, looking at factors that can affect cognitive functioning, other than what you see kind of in a gold color, the chemotherapy, the radiation therapy that goes along with the cancer treatment in itself, in the transplantation procedures, but with environmental demands, emotional function, sleep, fatigue, looking at age. Age can increase the likelihood that, with increasing age can increase the likelihood of cognitive dysfunction following transplantation and other medical conditions that the individual may be having. So there's a host of factors. And I think the biopsychosocial model kind of takes those things into account when we're trying to assess what is causing the cognitive difficulties, as well as what the treatment path might be to make a difference in that person's life. So how to improve cognitive abilities? How and where to start, excuse me, and some self-help strategies that I want to talk about. Where to start? As the illustration on the chart looks there, or the slide, is the first thing to do is to tell your medical provider. Because by telling your medical provider that you're having cognitive difficulties, it starts a search for factors that may be impacting cognitive functioning. And some of them may be what we call reversible causes and such, something that can be done about them. And if they are resolved or improved, that can improve your cognitive function. And give some examples here: medication for change, medications that may have some cognitively interfering effects. Maybe you can change, maybe your medical provider can change to a less interfering medication. Medication for sleep, medications for improved energy level, examination of blood counts to make sure that you're not having anemia or having any vitamin deficiencies. Pain can be a drain on cognitive functioning, and medications for that, physical therapy might be prescribed, and such. Treatment for depression and anxiety can all play a role in terms of if they're improved, can improve cognitive functioning. But I want to focus a good deal on, in our time remaining, on self-help strategies and things that you can do on your own. But again, first step, I think, is important to tell your medical providers to look at any reversible factors that may be playing a role here. But here's some self-help strategies that have been shown to be effective with improving cognitive functioning. particularly in cancer-related cognitive dysfunction. So what helps in day-to-day life? I think when I talk to individuals who've undergone or are undergoing cancer treatment, the one thing that I talk about is changing a mindset a bit, and it already starts there, because now we want to have some changes in a person's lifestyle that might improve cognitive function. And it's important to be mindful of the difficulties, what the limitations are, and how and what they may mean for your functional life. At the same time, not to be hard on yourself and increase the effects that they may have. So it's one thing to affect your cognitive function. It's another thing to affect how you're thinking about yourself. And there's an acceptance level that I think we talk about, in terms of having cognitive difficulties and not letting it lead into our emotional functioning too much. And the idea about this mindset is it's going to take some effort, a change in lifestyle, to maybe make some changes in your cognitive abilities and such. And importantly, to have the mindset that I can make a difference. If I do make some changes in my lifestyle, I can make a difference in my cognitive abilities and improve my sense of well-being, as well as my ability to do performances. And I know this is like a consciousness raising type of thing that, on mindset, but I think it's very important in terms of implementing strategies in your life and persisting in using those strategies. And so certain things that have been shown to help promote brain health and some key activities and such. And the key activities, and I think everyone on this Zoom presentation kind of knows these things: exercise, diet, mental stimulation, sleep, manage fatigue, stress management, and things. When I hear presentations on that, it helps me raise my consciousness level that, yes, I do need to key on these things, because sometimes we can be lax in terms of exercise and what our diet is, how much mental stimulation we're having, but they can have an effect upon our cognitive functioning. And exercise, for example, and I won't go too far into on the right side of the screen, but exercise can encourage growth of neurons in our brains, decrease inflammation that we've been talking about, helps to improve lung capacity, cardiovascular functioning, all important to our brain health, improves our emotional functioning, because stress can play a role in exacerbating our cognitive difficulties as well, and leads to just a general increases in our functional status and such. So one thing that we try to emphasize in terms of treatment of cognitive difficulties is exercise. And there's been some benchmarks with regards to exercise. But these all need to be worked out with your medical providers to make sure there's no contraindications to the type of exercise or the amount of exercise that you do, and maybe even some modifications about how you might do exercises. And some of the benchmarks are about 150 minutes per week of moderate to intense aerobic activity, walking, jogging, biking, swimming. However, any activity on a regular routine basis can be helpful, even if you're not meeting that 150-minute activities a week. If you are able, from a medical standpoint, and to do vigorous activities such as running or interval training, 120 minutes has been shown to be a good tipping point to help with our cognitive functioning. One of the big things that we talk about in terms of promoting cognitive functioning when there's been some declines is mental stimulation and a host of things that come into play. But maybe one of the most important things is the last one there that you see: maintain or increase social interactions. I think one of the changes I get to see and the people that I get to see in my over at the university when they're going through cancer treatments and stuff is during our time of COVID, and it's been isolating types of situations and stuff, to avoid COVID. But one of the more stimulating activities that we try to talk through is how to get on, activities that increase social interactions, whether in your families or with friends that you can interact with and have more frequency of that, because social interactions is one of the big things that help stimulate our brains. The conversations that we have really put our brain on point for stimulating activities. And of course, practicing new hobbies, reading books, as opposed to and being active as opposed to passively taking in TV, learning a new skill such as woodworking, gardening, and including in that would be taking a course, a college course, or some type of course that improves your, that's stimulating for you that you always wanted to do, solving puzzles. One of the things that has come in some of the research on mental stimulation has been learning a new language or musical instrument. And many of us may not go in that direction, but if you are inclined, that can be a very effective strategy for mental stimulation and shown to be associated with keeping our brain health and keeping our cognitive functioning at a good optimal level. One of the important things that comes up in terms of cognitive dysfunction is fatigue. It's probably a symptom that's maybe the most common symptom that in cancer-related cognitive dysfunction that we get to hear about, and 50 to 99% of people undergoing chemotherapy report some type of fatigue at some point in time during the course of treatment or following treatment, and that fatigue may last for a fairly long time. And what I get to hear about is that fatigue can arise when we mental exertion. And that is when we try to do a task and we're mentally exerting our cognitive abilities, we want to perform at a certain level and we exert a certain amount of effort, but that effort can lead to fatigue. And we still want to perform at a certain level, so we have to have more effort to put in, more mental effort. And that can lead to like what we call a coercive cycle. The more fatigue I have, the more effort I need to give. And it becomes a cycle there, and it becomes important to manage, because as I get more fatigued, the more cognitive difficulties I'm going to have. Now, how we might manage fatigue. One is certainly check. This is a clear one to check with your medical provider. Is there any co-occurring medical problems, such as anemia that you're having, sleep apnea? Pain can be a very fatiguing experience to have and have some consequences for cognitive functioning. Medications to increase energy might be prescribed to improve sleep, relieve pain. There are some non-pharmacological strategies for helping with fatigue. One of the key ones is pacing your activities, and many of us know this idea and think about pacing in our daily lives. If I'm fatigued, I want to spread out my activities. The important concept here is not just to take breaks before you get overly tired, but it's also to in the day to spread out your breaks, that before you get overly tired, you're kind of saving your energy as the day goes on. And so to work out your schedule in the day, if it's possible, that even before you get overly tired, you're taking your breaks. Exercise, nutritional changes to boost energy, and importantly, which related oftentimes to our fatigue, is how well we're sleeping. We talked about maybe some medications for sleep or something like that, or if you have sleep apnea, and ensure that you're talking to your medical provider about those conditions. But what are some things or what we call behavioral strategies for managing sleep as well? And there's a number of key ones here on this slide that that you can look at after the presentation. Is that I'll point out a couple key ones here in this kind of busy slide. One is the first one, that really have a consistent sleep schedule. If you're having sleep difficulties, have a consistent schedule when I go to bed and when you wake up, to try to conform to that. And then importantly, and sometimes it's very hard to do that, to eliminate napping or limit it to no more than 30 to 60 minutes a day. If we think about sleep as a savings account, if I take out some dividends out of my savings account and nap, I don't have as much left over for nighttime sleep. So we oftentimes say in these sleep hygiene strategies is to try not to take naps and stuff. And the other thing is on the right hand side of the slide is having a relaxing bedtime routine. Instead of watching an exciting movie or doing something along those lines, have a way that you're kind of like on a landing on a runway, or slowly slowing down in the day and going to sleep. But those are some ideas, but it becomes an important idea of some self-help strategies that can help with fatigue, and which in turn help with cognitive functioning. And of course, stress management strategies come into play. I'm in neuropsychology, and everything happens in the brain, whether it's our cognitive functioning or our emotional functioning. Stress has a way of competing for parts of our brain that can detract from our cognitive functioning. And if I can manage stress well, I can improve my cognitive functioning and my focus, pretty well in that. And so a lot of different avenues are present for you in terms of self-help, books, relaxation, and even during COVID times, there may be a yoga class to join, and then also engaging in pleasurable activities. If stress and anxiety are quite heightened in your daily life, and it's difficult for even self-help, strategies to come into play, I think psychotherapy can be effective. I think one of the most effective things of psychotherapy is learning strategies, effective strategies for managing stress. And of course, there can oftentimes be medication for that as well. But that becomes an important ingredient in how we manage stress to improve our cognitive function. So we talked about certain things you can improve brain health with. How can you treat the symptoms of cognitive functioning? And I have a few before we end here, strategies that we can think about. There are two types of strategies for improving cognitive abilities. One is what we call restoration, and the other one is compensation. When we think about restoration, is the thing that we all likely want to have. If I'm having cognitive difficulties, what can I do to increase my brain's natural ability to pay attention, to learn new information and stuff, to solve problems and things? And it's oftentimes we think if we do mental exercises, and sometimes they're off of a computer-based training programs. There's many out there on the market, now that if I exercise my brain, like a muscle, I'm going to improve my cognitive abilities and stuff. And sometimes we can use medications to boost cognitive, our brain energy and cognitive functioning. On the other side, or not so much other side, but another form of treatment for cognitive dysfunction is what we call compensation, or compensation strategies. And here, the focus is on learning strategies that reduce the interference that the cognitive difficulty has on doing a given task. So you're not necessarily improving a person's attention or memory, for example, abilities, but you're rather reducing the effect of that difficulty on ability to perform different tasks. And there are certain strategies that we'll talk about in a moment that you can do on your own to do that. Restoration strategies are fairly controversial still. Whether or not exercise of the brain, like through computer programs and training programs, can affect it. It's promising for some individuals, and especially, what some research has shown is that can increase the confidence that an individual can have. But oftentimes, if they're on a computer program that does pre-post testing, like if I test my cognitive abilities before I start the exercise program, or a number of sessions, like say 20 sessions, what am I like, after that on the test that I took, prior to treatment? You can see some improvements on testing, and oftentimes that's what's reported by for example, the manufacturer of the cognitive program. But the question still remains about that is whether or not, if you have improvements on the computer program that your training program you have, is it improving your memory functioning or your attentional focus in your daily life? Then we call that generalizing from the training to the to everyday life. And that is where the controversy lies in using restorative strategies. Some findings show some support, but a good deal of findings do not show support for this generalized ability of doing cognitive exercise and such on your daily life. And of course, there's a monetary cost that come with some of these computerized programs that a person has to weigh whether or not I'm going to engage in that. And the second thing about another thing about the research is sometimes the research hasn't compared the cognitive training model that's being that a person used with other forms of treatment that may not have a monetary cost to them and such. So I think the verdict is still out on restorative strategies, but still something to explore. Compensation, what you can do on your own. And I'm going to illustrate compensation strategies by looking at attention and memory functioning here. In managing attention problems through these compensation deliverables, how can you reduce down the interference of the difficulty on performing tasks? One of the things I talk to patients about, and one of what we do in our neuro-rehabilitation program is we ask an individual to become more aware, more mindful of what they're doing in their daily lives, where they're becoming more forgetful. Like, for example, one of the common things is, where did I put my keys? Where did I put my wallet? Where did I put my, anything that's personal and such, as they come home and such and things. And so we have some practice about becoming mindful. When you walk in the door, I'm going to almost do self-talk. Sometimes it is self-talk. I'm putting my keys on the kitchen table. I'm putting my wallet on the kitchen table. And sometimes people will say, did I take my vitamins or not? And to have a lot of self-talk and have exercises that we become more aware of what our function is going to be. Or if I'm going out the door, I'm self-talking. Do I have my keys? Do I have my wallet? Those types of things, come into play. So that's one of the training things. That's a new habit that we're trying to have the individual learn, and that is become more mindful of common tasks that we almost do automatically, and therefore we start to forget at times. Keep distraction to a minimum when doing complex tasks. Remove clutter from the desk. Turn off your phone. Perform a task away from the computer. Keep those distractions down to a minimum and such. Complete only one task at a time. I think one of the common cognitive difficulties that individuals has is this idea of multitasking, of doing divided attention, doing things at one point in time, talking on the phone and cooking at the same time. Try one task at a time and such. Divide complex tasks up into simple steps. Importantly, control the pace of your performance or the speed of information coming in, if possible. Sometimes we can't do that and stuff. Take breaks in tasks to preserve your energy, which will increase your attentional focus. Compensation problems for memory. And if you look at the cartoon, you can see the art going away and the dinosaur saying, oh, I didn't remember that. But memory difficulties can break down in various stages. Acquisition is the information of getting information in. Storage is how well we can retain that information over time, and retrieval of the information becomes important in terms of memory functions. So learning new information, getting it in, storage and retrieval, and the breakdown can occur anywhere along the way. And strategies for improving memory, compensation strategies for improving memory can apply to each stage. So compensation strategies by the stages for acquisition, for learning information, maintaining a good focus on the information, minimize distractions around. Make sure you understand the information. And importantly, if it's a conversation, I think one of the strategies that we have individuals try to do, have the individual repeat the information. Keep your focus on the information. Sometimes it's important to ask for information to be given slower if it's in a conversation. Or importantly, if you're in a medical provider visit, to make sure it's being conveyed to you at a speed that you can understand it at. So what's some things to help with storage and retrieval? I think one of the things, if it's important information, to step away and to mentally rehearse that information. That gets into repetition, and repetition for most individuals does help with memory and function. Organize the information. Any underlying themes that you can associate the information that the information has, to categorize the information or to chunk that information. Link it to something meaningful in your life. And so if you're getting new information in that's important, or a conversation, how does that relate to aspects of your life? And of course, using mnemonic devices, acronyms, easy to remember phrases. First letter represents the word on a target list. So if I have a shopping list, maybe I only want 3 items that I'm going to do. So I use the word Sam, salad stuff, apples, medication that I want to buy. But I can remember the word Sam, and hopefully by each of those letters, it's going to lead me to what was on the shopping list for that day. And of course, importantly, in all these compensation strategies is a written computerized compensatory strategies. And here we're talking about a memory book, day planner, a day timer, something that you can centralize the information that you have in something that's organized and such. And if you don't have one and you're having cognitive difficulties, I think this is one of the most important things you can do for yourself, is to have a memory book or a day planner or a day timer. And the idea here is to avoid the sticky approach here, to have a lot of different stickiness. You know, sometimes I will use that approach in my office, and it never works very well. They're all over the place. And so I really do try to keep track in a day planner of certain things. And whether it's on my smartphone or some type of written type of day timer. The important thing about smartphones is you can, right, have alarms that can signal you, you know, when the important tasks have to be done, like taking medications or something of that sort. What to put in, daily schedule, summary of important conversations, you know, including like if you're going to a care provider visits. But one of the important things is to remember to use your memory book. There's many times when I'm interacting with individuals on a visit where there's no memory problems, and sometimes they'll bring their memory book with them, and sometimes they won't. And the days that they don't, we always take time at the end of the session to write down what was important in the session that we had. But that's one of the important ingredients. It's one thing to have a memory book. It's another thing to remember it. And I can't emphasize that more and such. Another strategy is pillboxes for medications. And one of the things that can be very, very helpful at home is to use a whiteboard in the kitchen or something, or someplace that's central where you can write down the schedule for the week and gives you an idea of what the upcoming schedule is. And again, a compensatory strategy to help with recall. What else to do? Well, I'm a neuropsychologist, and sometimes, you know, providers would say it would be important to have a neuropsychological evaluation, especially if day-to-day functioning is being affected, like you're having difficulty if you are working, having difficulties with your work performance, or if difficulties seem to be worsening over time. What is the nature of that worsening over time? Important to consult with your physician about that. What a neuropsychological evaluation can be helpful in is determine the type of degree of problems, help to disentangle the factors that may be affecting cognitive functioning, determine readiness to go back to certain activities like work, and also importantly, and maybe most importantly, helps providers get a roadmap for treatment to help with cognitive functioning. And there can be formal neuro-rehabilitation treatment and a variety of facilities that you may have available to you if necessary, getting physical therapy for or cognitive rehabilitation, oftentimes by a speech therapist that looks at strategies for improving cognitive functioning, typically focused on compensatory systems, doing physical therapy to help with pain that might be interfering with cognitive functioning. Occupational therapy can be invaluable about improving abilities in the home setting. Psychotherapy for stress, vocational rehabilitation if necessary, you know, and possibly following by a physician in the rehab medicine. That provides an integrative approach to help with cognitive functioning and other factors that may be leading to decreased function in your daily life.